Dear audience, Assalamu alaikum. I am Professor Shamsudjaman, Professor of Pathology. I welcome all in today's fifth lecture on hematology. In the fourth lecture, I have told you about macrocytic and megaloblastic anemia. Today, aplastic anemia and pancytopenia. First come to aplastic anemia. Then Pancytopenia. First come to what we mean by about aplastic anemia. Definition: anemia due to hypoplasia of marrow is called aplastic anemia. Is called aplastic anemia. So anemia due to hypoplasia of bone marrow is called aplastic anemia. It is also called hypoplastic anemia. Also called hypoplastic anemia. Dear audience, now come to, if we consider bone marrow, suppose bone marrow, we know in bone marrow half of marrow is fat cell and half of marrow is hemopoietic elements. So in normal bone marrow, half is fat cell and half is hemopoietic element. So if you consider this bone marrow in a slide, in bone marrow in a slide. So if this is the fat space or fat cells, in between these are the marrow elements. These are the marrow elements. So if you consider in marrow elements red one, these are the marrow elements. So these space is the fat, space for the fat. Around this, these are the hemopoietic elements. And we know from the hemopoietic elements, cells, RBC series, WBC, platelet, all are produced from the hemopoietic element. If hypoplasia of the bone marrow occurs, if hypoplasia of bone marrow, what happens in hypoplasia? In case of hypoplasia, hemopoietic element is reduced. So in hypoplasia of marrow, what happens? The decreased or reduced hemopoietic element. Reduced hemopoietic element. So if reduced hemopoietic element, what will happen? If you consider this is the bone marrow and medullary cavity and bone, and this medullary cavity contains the bone marrow, and if there is hypoplasia within the marrow, there will be diminished or decreased hemopoietic element. What will happen? There will be decreased RBC production, and there will be decreased WBC production and decreased platelet production. So all three will be reduced in aplastic anemia. So how hemopoietic element is maybe decreased in hypoplastic anemia? It may be due to increased fat cell. If the fat cell is increased, there will be decreased hemopoietic element. Or other words, if there is fibrosis in the bone marrow, there will be decreased in hemopoietic element. So there are a lot of causes of decreased hemopoietic element. One is increased fat, another is bone marrow fibrosis. And if there is decreased hemopoietic element, RBC, WBC, platelet, all will be decreased. So aplastic anemia is characterized by, aplastic anemia is characterized by If RBC is reduced, characterized by anemia. If WBC is reduced, characterized by leukopenia. If platelet is reduced, characterized by thrombocytopenia. Now come to, if anybody suffers from aplastic anemia, what may be the clinical presentations? Now come to clinical presentations. Of aplastic anemia. Clinical presentations of aplastic anemia. Due to anemia, there will be symptoms of anemia. Like pallor, like effort intolerance, palpitation, fatigue. These are the symptoms of anemia. Then, due to leukopenia, what will happen? Due to leukopenia, there will be frequent infection, and due to frequent infection, there will be frequent fever. So, frequent fever due to frequent infection, and this frequent infection is due to leukopenia. And if there is thrombocytopenia, what will happen? There will be bleeding manifestations. Due to thrombocytopenia, bleeding manifestations like nasal bleeding, gum bleeding, purpuric spot, rectal bleeding. So these are the different clinical presentations in aplastic anemia. Now come to how can we classify aplastic anemia, or how can we know the different causes of aplastic anemia. Now come to causes of aplastic anemia. Again, we recall, in aplastic anemia, the hemopoietic element of bone marrow is reduced. The cause may be idiopathic, in most of the cases, the cause of aplastic anemia is not known, so it is idiopathic aplastic anemia. Then secondary aplastic anemia. Aplastic anemia due to certain diseases. It is called secondary aplastic anemia. What are those? It may be due to administration of drugs. Due to administration of certain drugs, that drugs may cause depression of bone marrow, and so there is aplastic anemia. What are those drugs? Like chloramphenicol, anti-cancer drugs, nowadays, patient bearing cancer, if patient is given chemotherapy, after getting chemotherapy, there is chance of development of aplastic anemia. Then radiation. Nowadays, cancer bearing patient gets radiotherapy. After getting radiotherapy, patient may develop aplastic anemia. So radiation in cancer-bearing patient, radiotherapy. Following radiotherapy, there is chance of development of aplastic anemia. Then chemical exposure. Certain chemical exposure may lead to aplastic anemia. Then infective hepatitis. Dear audience, you know, if anybody suffers from hepatitis caused by virus C, he or she may come to you with Pancytopenia. And if you investigate that case, you can get aplastic anemia, patient suffering from hepatitis caused by virus C. These are the secondary aplastic anemia. The third one is constitutional. The example of constitutional aplastic anemia, example is inherited defect in DNA repair. Inherited defect in DNA repair. Example of inherited defect in DNA repair, Fanconi's syndrome. So in Fanconi's syndrome, patient develops aplastic anemia, and it is nothing but inherited defect in DNA repair. Dear audience, you know, our DNA undergo damage, and there is system in our body to repair that damaged DNA by certain enzymes. If there is any defect in the repairment of this damaged DNA, the DNA will not be repaired. And if DNA is not repaired, there is a disease. It is called chromosomal breakage syndrome. Again, if this is the DNA, suppose this is DNA. This DNA undergo damage like in bright light. If we exposed in bright light, there is damage of DNA. Again, if you come back to dim light, the damaged DNA undergo repair. So there is mechanism, there is system, there is enzymes to repair the damaged DNA in our body. If there is defect in the DNA repair, if there is defect in the repair, the DNA will not be repaired, and there will be disease that is called chromosomal. This is called chromosomal breakage syndrome. Again, recall, if damaged DNA is not repaired automatically in our body, this is a disease, and this is called chromosomal breakage syndrome. And this chromosomal breakage syndrome includes ataxia telangiectasia, xeroderma pigmentosum, Bloom syndrome, and Fanconi's syndrome. So Fanconi's syndrome is nothing but one of the chromosomal breakage syndrome. So what happens in Fanconi's syndrome? This Fanconi's syndrome is characterized by or associated with aplastic anemia. It is associated with aplastic anemia. Then there is abnormal function of the proximal convoluted tubules of the nephron. Abnormal function of proximal convoluted tubule of nephron. As there is abnormal function of the convoluted tubule in the nephron, what will happen is there is polyuria. There will be osteomalacia, etc. So this is the Fanconi's syndrome in brief. Now come to, dear audience, if anybody suffers from aplastic anemia, how to diagnose aplastic anemia in laboratory. Now come to laboratory diagnosis of aplastic anemia. So, laboratory diagnosis of aplastic anemia, or this is laboratory diagnosis of hypoplastic anemia. First, we have to do blood examination. Then bone marrow examination. Bone marrow examination. First come to blood examination. First come to blood examination for aplastic anemia. We have to do first hemoglobin estimation. As it is anemia, it will be decreased. We have to do ESR. It will be very high ESR. Then we have to do TLC, total leukocyte count. As it is aplasia or hypoplasia, total leukocyte is decreased. That is leukopenia. That is leukopenia. Then we have to do DLC. It is normal distribution. Then we have to do bleeding time. If the patient come to you with bleeding manifestations, so we have to do bleeding time and clotting time. As there is thrombocytopenia, bleeding time will be prolonged. Bleeding time, prolonged bleeding time. Then we have to do clotting time, coagulation time. It will be normal. As there is platelet decreased, no defect or deficiency in the coagulation factor, so clotting time is normal, bleeding time is prolonged. Then we have to do peripheral blood film. We have to do peripheral blood film. First come to RBC series. RBC series. Cells are normocytic and normochromic. Dear audience, you know, in case of aplastic anemia, acute hemorrhagic anemia, multiple myeloma, we get the normocytic, normochromic RBC. That is MCB, MCH, MCIC are normal. So here we'll get cells are normocytic and normochromic. But population of RBC is decreased. So population of RBC in the peripheral blood film decreased. So population of RBC in peripheral blood film is seen decreased. Now come to WBC series. WBC series. WBC series, cells are mature but show leukopenia. Cells are mature but cells are show leukopenia. Then platelet. Platelet seen decreased in the film. That film we have studied. In the film, the population of platelets is decreased. So this is the peripheral blood film findings. Now come to bone marrow. Now come to bone marrow examination. Now come to bone marrow examination. Dear audience, you know, in bone marrow we see the cellularity we see the myeloid erythroid ratio, erythropoiesis, granulopoiesis, and megakaryocyte and platelet, etc. And I have told you initially in this lecture, in aplastic anemia or hypoplastic anemia, hemopoietic element is reduced. So as hemopoietic element is reduced, so cellularity will be hypocellular. So marrow is hypocellular. So if you consider the bone marrow, here like this, medullary cavity, and this is the fat, and if red one is the marrow element, as the marrow element is decreased in hypoplastic anemia or aplastic anemia, so there will be hypocellular marrow. So marrow is hypocellular with normal myeloid erythroid ratio. Why erythroid and myeloid ratio normal? Because I have told you, as there is decreased amount of hemopoietic element, all the series RBC, WC, platelet, all series cells are reduced. So there is normal myeloid erythroid ratio. So marrow is hypocellular with normal myeloid erythroid ratio. Now come to erythropoiesis. Erythropoiesis is depressed but normoblastic. What it means? As marrow elements is decreased, so there will be decreased erythropoiesis, depressed. But whatever may be the amount of synthesis of RBC, the erythropoiesis is normoblastic. The nucleated cells are normally produced or normoblasts. Then granulopoiesis. The series from which the granulocytes are produced, these are granulopoiesis. So granulopoiesis is depressed with all stages of maturation. What it means? As there is hypoplasia, decreased hemopoietic element, RBC series depressed, that is erythropoiesis depressed. So WBC series granulopoiesis is also depressed. Although it is depressed, the cells that are synthesizing or that are producing, there will be all stages of maturation of the granulopoiesis. Then megakaryocyte. Megakaryocyte seen reduced. Megakaryocyte is reduced. No parasite found. No parasite found in the marrow examined. So this is the bone marrow findings of aplastic anemia, and this is all about the aplastic anemia. Dear audience, now come to Pancytopenia. First come to definition of Pancytopenia. You know, pan means whole. Pan means whole. All. Cyto means cell. Penia means decreased. Now come to what is the definition of Pancytopenia. In Pancytopenia, RBC, WC, platelet all are decreased. So definition is simultaneous presence of anemia, leukopenia, and thrombocytopenia. So simultaneous presence of anemia, leukopenia, and thrombocytopenia is called Pancytopenia. So in Pancytopenia, RBC is decreased, so there is anemia, and there is decreased WBC, that is called leukopenia, and there is decreased platelet, and that is called thrombocytopenia. So in pancytopenia, all three elements is decreased. Now come to causes of pancytopenia. Causes of pancytopenia. The causes of pancytopenia may be aplastic anemia. Aplastic anemia is the important cause of pancytopenia. Then subleukemic acute leukemia. Subleukemic acute leukemia. Then administration of drug. So administration of drug is also associated with pancytopenia. Dear audience, the cancer bearing patient when gets anti-cancer drug, usually they develops anemia, leukopenia and thrombocytopenia. That is, they develops pancytopenia. So before giving chemotherapy and after giving chemotherapy, whether patient is suffering from pancytopenia or not, complete blood count is done, like anti-cancer drug. Then radiation, that is given in cancer bearing patient as radiotherapy. Then bone marrow infiltration or bone marrow replacement or marrow replacement. Dear audience, I have told you marrow is composed of half marrow element, that is hemopoietic element, and half is fat cells. If marrow is infiltrated or marrow is replaced, then there will be decreased RBC production, decreased WBC production and decreased platelet production. So there will be pancytopenia. What are the causes of bone marrow infiltration or bone marrow replacement? So bone marrow replacement or bone marrow infiltration may occur in number 1, multiple myeloma. You know, multiple myeloma or myeloma, it is the malignant neoplasm of cancer of plasma cell. It is the malignant neoplasm of plasma cell. You know, this is the plasma cell, eccentric nucleus, cartwheel appearance. This plasma cell produces antibody. You know, this plasma cell in the bone marrow produce or develop a cancer that is called myeloma or multiple myeloma, like this. So myeloma or myeloma is the cancer of plasma cell. If this cancer occurs in the bone marrow, there will be disturbed marrow and there will be decreased RBC, WBC platelet production. So this is one of the cause of bone marrow infiltration or replacement. Number 2, metastatic tumor of bone. If anybody suffers from cancer either in the lung, breast, prostate, etc., if this cancer metastasize in the bone, it will disturb the bone marrow and there will be decreased RBC, WBC platelet production. So there will be pancytopenia in metastatic tumor of bone. Myelofibrosis. Fibrosis. Dear audience, you know, again I recall, marrow, normal marrow composed of half fat cell and half hemopoietic element. If there is fibrosis within bone marrow, there will be reduction of production of RBC, WBC platelet, and it will lead to pancytopenia. And the another cause of pancytopenia is hypersplenism. So, aplastic anemia, subleucemic liquid leukemia, administration of drug like anti-cancer drug, radiation, bone marrow infiltration, hypersplenism, all are the causes of pancytopenia. Dear audience, now come to, if anybody suffers from pancytopenia, whatever may be the cause, what may be the clinical presentations. So, clinical presentations, of pancytopenia. As in pancytopenia there is decreased RBC, so there will be anemia. So, first symptoms of anemia. Like pallor, fatigue, palpitation, effort intolerance, etc. Then due to decreased WBC, there will be frequent infection and patient will develop frequent fever. So, frequent fever, and usually we have seen if anti-cancer drug is given to a patient and if it leads to pancytopenia, there will be leukopenia and patient develops oral ulcerations. As there is decreased platelet, there is thrombocytopenia. So, in pancytopenia there is bleeding manifestations. Dear audience, I have told you here subleukemic acute leukemia. What is this? I have told you subleukemic acute leukemia is associated with pancytopenia. Now come to what is subleukemic acute leukemia. Dear audience, we know leukemia is the neoplastic proliferation of hemopoietic stem cell, and usually in all leukemia there is leukocytosis. So, in all leukemia there is leukocytosis, TLC is increased, and in all leukemia there is atypical or immature cell in peripheral blood, immature cells more than 15% in blood and in bone marrow. So, in leukemia there is leukocytosis, increased TLC, and bone marrow and in blood more than 15% blast cell or immature cell. This is leukemia. What about subleukemic leukemia? In case of subleukemic acute leukemia, it is an acute leukemia. It is acute leukemia, and in this leukemia there is blast cells in peripheral blood film and in bone marrow there is blast cells, either lymphoblast or myeloblast. So, it is an acute leukemia and there is blast cells. As it is leukemia, we should get increased number of TLC, but in subleukemic acute leukemia, although it is acute leukemia, although there is blast cells, the total count of WBC is within normal limits or below the normal limits. So, TLC does not show leukocytosis, rather leukopenia or TLC within normal range. If acute leukemia with normal TLC or acute leukemia with leukopenia, that acute leukemia is called subleukemic acute leukemia. That leukemia is called subleukemic acute leukemia. So, in subleukemic acute leukemia there is blast cells, it is acute leukemia, but the total count of WBC is normal range, within normal range, or there is leukopenia. Now come to laboratory diagnosis of Pancytopenia. Laboratory diagnosis of Pancytopenia. We have to do blood examination, bone marrow examination, and sometimes on the depending on the patient, we have to do urine for Benz-Jones protein. Now come to blood examination first. We have to do hemoglobin estimation. It will be decreased. We have to do TLC. It will be decreased. We have to do DLC. It is normal distribution. Then we have to do bleeding time. As there is thrombocytopenia, it will be prolonged. Bleeding time is prolonged. We have to do clotting time. It is normal because it is not a case of coagulation disorder. Then we have to do total platelet count. It will show thrombocytopenia. So count of platelet will be less than 1.5 lakh. Then we have to do peripheral blood film, PBF, peripheral blood film. What will be peripheral blood findings? RBC series. As in Pancytopenia, RBC, W platelet all are decreased. So RBC series cells show decreased population of RBC in blood film. Decreased population of RBC in blood film. Then WBC series, what the findings? Show leukopenia. And platelet is decreased in number in the peripheral blood film. So RBC decreased population in peripheral blood film, WBC leukopenia, platelet decreased in number. Now come to bone marrow examination. Dear audience, if the cause of Pancytopenia is aplastic anemia, the bone marrow will show the fissures or findings of aplastic anemia. If it is a case of, if multiple myeloma is a cause of Pancytopenia, we can say if the cause of Pancytopenia is aplastic anemia. So bone marrow will show fissures of aplastic anemia. If cause is multiple myeloma, if the cause is multiple myeloma, what will be bone marrow findings? Bone marrow will shows sheets of immature plasma cells or sheets of myeloma cells in case of multiple myeloma causing aplastic anemia. If cause is metastatic tumor of bone, if the cause is metastatic tumor of bone, the bone marrow will show atypical cells or cancer cells. So bone marrow shows cancer cells. If the cause is myelofibrosis, then bone marrow shows area of fibrosis with decreased hemopoietic element. So this is the bone marrow findings. And another examination, urine for Benzon's protein. Dear audience, you know, if anybody suffers from multiple myeloma, in about 40% cases, if we do urine for Benzon's protein, then we can get Benzon's protein in urine in about 40% cases of multiple myeloma. So Benzon's protein, according to the name of scientist, it is nothing but light chain of immunoglobulin. So light chain of immunoglobulin, either lambda or kappa, this is called Benzon's protein. It was first invented by scientist Benzon's, and if light chain is found in blood in multiple myeloma, the light chain, due to its lighter molecular weight, it can passes through the kidney and comes in urine, and we can detect the light chains of immunoglobulin in urine as Benzon's protein. This is all about the Pancytopenia. Thanks all.